So today in this lecture we will discuss the appendicular skeleton. Previously we have discussed the axial skeleton and the introduction to skeleton. As we know that the skeleton is the framework of body, around which all the body is made, right? And the human skeleton is it can be divided into two parts, the axial skeleton and the appendicular skeleton. The axial skeleton is composed of 80 bones. We have discussed this in previous lecture. And appendicular skeleton is composed of 126 bones, and we will talk about these 126 bones in this today's lecture. The axial skeleton is fixed on its place, and it's further divided into three parts: the skull, the ribs cage, and the vertebral column. Right? The skull is further divided into face, and it is further divided into face and cranium. Right? The ribs cage are divided into true ribs, false ribs, and floating ribs. We have discussed this in the previous lecture. Vertebral column is further divided into 5 regions and is composed of 33 bones. Now in today's lecture we will talk about this appendicular skeleton. Appendicular skeleton is the skeleton which consists of 126 bones. And this appendicular skeleton is allows the body for movements, because these are the bones which are suspended from the axial skeleton. So the appendicular skeleton bones are skeletal bones are suspended from axial skeleton. Right, so this is very easy, that axial skeleton is fixed on its place. It is fixed and not movable part of the human skeleton, and this appendicular skeleton is the suspended skeleton from this fixed skeleton, and it allows the body for movements, and it also allows the body for weight bearing. Right, appendicular skeleton is further composed of mainly two parts, but it can be divided into 4 parts. The first part is the pectoral or the shoulder girdle, or it is also known as pectoral girdle. Right, the upper limbs. The second part is upper limbs, the pelvic girdle and lower limbs. Right, the shoulder girdle and upper limbs are composed of 64 bones, and the pelvic and lower limbs are composed of 62 bones. So collectively it forms 126 bones. So we can say that appendicular skeleton is composed of further 126 bones. And if we add the 80 and 126, if we add 80, which are the bones present in axial skeleton, and 126 bones are in appendicular skeleton, it forms 206 bones, and this 206 bones make our whole skeleton. So we can say that human skeleton is composed of 206 bones in adults. Right, in this skeletal diagram we can see these blue parts. Right, for example, this is skull, right, and this whole thing is called ribs cage, right, and this is called the vertebral column. So these three things collectively it forms the axial skeleton. For detail of this axial skeleton you can watch the previous lecture. Today we will discuss these suspended parts. For example, this is the rib cage and the part of axial skeleton, and these are from here up to here. It is called upper limbs. This region is called shoulder girdle, right? For example, this is called shoulder girdle, right? And these bones makes the upper limbs, right? This part is here. This is called the pelvic girdle, and this blue bones is called lower limbs. So the shoulder girdle, the upper limbs, the shoulder girdle, the upper limbs, the pelvic girdle, and lower limbs, it forms the appendicular skeleton. These are the parts of appendicular skeleton, and all these appendicular skeleton have 126 bones, right? Now we will discuss the appendicular skeleton, the upper and lower limbs bones in separate parts, right? For example, you can see here that this is one-sided upper limbs diagram, right? So this is upper limbs appendicular skeleton. This is appendicular skeleton. Appendicular skeleton is divided into upper limbs, and upper limbs are composed of further 64 bones, right? Because we have two-sided right and left, so here we have this is left side upper limbs bones, which have this shoulder blade, this bone, this shaded bone, this is called scapula, right? This is the scapula. You can see here this bone is called scapula, right? This black bone is called, this bone is called the clavicle, and collectively these two bones forms the shoulder girdle, right? This shoulder girdle makes the joints here, which is called the shoulder joint. We will discuss in joints, but this joint is called, this whole, this is called shoulder joint, right? With the scapula we have this long bone, which is called humerus. This bone is called humerus. This joint is called the knee, sorry, this is called elbow joint, right? Now after humerus we have these two bones here. For example, this is scapula, this bone is called the clavicle, and this bone is called the humerus. After humerus, after this elbow joint, we have these two bones, right? For example, this is my left hand and this is the humerus. This lateral side bone is radius, and this medial side bone is called the ulna. So I am shading here this bone in red color. This red color bone is called radius. It's called radius, and I am shading this bone in green color. This green bone is called, which is on medial side, it is called ulna, right? After this radius and ulna we have this wrist joint. This joint is called, this joint is called wrist joint. We will discuss these joints in detail in further lectures, but this is the elbow joint. Next to elbow joint, this joint is called the wrist joint, and this wrist joint have 8 bones. These bones are 8 bones, and collectively these bones are called the carples. These bones are called carpels, right? After carpels, for example, here we have carpels, and after carpal we have this farm, and this farm is made up of 5 bones further, and these bones are called, for example, I am shading for your clearance these green bones that forms the form 1, 2, 3, 4, 5. These 5 bones are collectively called metacarples, right? And these 8 bones are called the carpels. After that we have, after this form we have these fingers, and these fingers, each finger have 3 bones further, but this finger have 2 only, right? So these are called pallenges. For example, I am shading these bones in blue color. These are phalanges. Phalanges, right? And we have how many phalanges? We have 14 in each hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So we have 14. Now, if you want to count these all bones of upper limbs, right? For example, we have right side and we have left side. For example, if I have this humerus, one on each side, so we have 2 humerus in pair form. This is one, this is second, this is radius 1, radius 2, ulna 1, ulna 2, scapula 1, scapula 2. This is the right scapula, this is the left scapula. So for example, if you want to count these all bones, first, for example, I am numbering these bones. This first, second, third, this fourth, this is fifth, sixth, seventh, and eighth, right? For example, here 1, 2, 3, 4, 5, 6, and 7. First is scapula. We have scapula. So we have right and left scapula. So we have 2 scapulas. Second is clavicle. We have 2 clavicle. This is right clavicle and this is left clavicle. So we have 2 clavicle. Like that, we have 2 humerus. This we have right humerus and left humerus. So we have 2 humerus, right? We have 2 radius. So how many radius we have? 2. After we have ulna, and how many ulna we have? 2, because this is right ulna and this is the left ulna. So simple, right? On 6, these are the carpels, and I have told you that each hand have 8 carpels, and arranged in 2 rows, the proximal row and the distal row. So we will discuss that the bones of the names of the carpels in separate lecture, right? But we have how many carpels? We have 8 carpels in each hand. So we have 2 hands, so 16 carpels we have. Lastly, we have the metacarpels. We have metacarpels, right? And we have 5 metacarpels in each hand, and we have 2 hands, so we have 10 carpels, metacarpels, right? And 8 we have phalanges. We have phalanges, and in each hand we have 14 phalanges in 2 hands. Because we have 14 phalanges in one hand, so we have 2 hands, so we will multiply 14 into 2, we will get 28 phalanges. If we add all these bones, we will get 64. So in upper limbs we have 64 bones. In upper limbs we have 64 bones. These are the bones of upper limbs, right? If we talk about the joints of upper limbs, we have this one joint. I am numbering also these joints. For example, we have this one joint, this is second joint, this is third joint, this is fourth, right? So we have, for example, we have the joints of upper limbs. Joints of upper limbs. The first joint, this is the acromioclavicular joint. Acromioclavicular joint, because here the acromion process of the scapula and the clavicle make the joint, right? The second, we have this joint too. It is called glenohumeral joint, right? Because the head of the humerus and the glenoid cavity of the scapula makes the joint. So this is the gleniohumeral joint. And next is the third one is the elbow joint. In elbow joint we have the humerus plus radius plus ulna. It forms the elbow joint. And here fourth we have the wrist joint, right? A wrist joint is in between the carpals, the metacarples, and the radius and ulna, right? The proximal row making the joint with this radius and ulna, and the distal row makes the joint with the metacarpals. So this is all about the bones of the upper limbs. The second part of this appendicular skeleton is the lower limbs, right? So the second part here we have lower limbs, right? And lower limbs have 62 bones, right? Remember that in lower limbs we have some bones which are in fused form, right? For example, this is the pelvic girdle. This whole area is the pelvic girdle, right? This is the pelvic girdle. In pelvic girdle we have three bones, right? For example, one is this bone. I am shading this in red color. This palpable bone, which is we can palpate this bone here, right? This is called the iliac bone. This is called the iliac bone, right? One bone is present on the posterior side. This I am shading this bone in green color, and this bone is called the ischial bone, right? And the next bone I am shading this bone in blue color. This bone is called the pubis bone. This is called the pubis, and these all the bones are in fused form. So it's count as one bone, and it is called the hip bone, right? So we have right and left hip bones. We have right and left hip bones, right? The next bone, this bone which I am shading in black color, this bone is called the femur, one of the strongest and longest bone in body, right? This bone is called the femur, and this bone is also known as thigh bone, right? This bone is called also, this is called the thigh bone, and this is the femur, right? This red bone is which is the sesamoid bone here, and this red bone is called the patella. This is called patella, right? The next we have this is left side, right? This is the left side of lower limbs. So if I have the left side, on left side this is the lateral side, and this is the medial side. On lateral side, laterally we have fibula. We have fibula, and I am shading this bone in green color, right? This is fibula, right? And I am shading this bone in red color. This is the medial bone of the lower leg, and this is called this bone is called the tibia. This is called the tibia, right? Here these bones are called tarsals. And the form of the foot, we have these. I am shading these bones in red color. This is the 1 2 3 4 5. We have 5 metatarsals. In upper limbs we have carples and metacarples, and lower limbs we have tarsals and metatarsals, and lastly we have pallenges, right? If you want to count these bones and compare this with these upper limbs bones, right? We have two hip bones, because we have right side and left side. The right and left we have two hip bones. We have two femur, of course we have two femur, because we have one right femur and one left femur. We have two patellas, right and left. We have two fibula, two tibias. Now we will compare the tarsals with carpals. carpels making this wrist joint, and carpels are 8 in number, but tarsals are 7 in number, right? So one foot have 7 tarsals and we have 2 foots right and left, so we will multiply the 7 into 2 and we will get the 7 into 2 14. The metatarsals are 5, so we have 10 metatarsals, and pallenges, each foot have 14 pallenges, and if we multiply this into 2 we will get 28, and when we count or add these all bones we will get 62 bones. So upper limbs have, lower limbs have 62 bones, right? The iliac bone, ischial bone, pubic, it making the hip bone, right? The hip area, the pelvic area, the femur bone, patella, fibula, tibia, tarsals, metatarsal, pallenges, right? Now, if we discuss the joints of, if we want to discuss the joints of lower limbs, right? For example, I am going to number these joints. For example, we have 1, 2, 3, 4, right? The first, this joint, this is the ilium and this is the sacrum, this is sacrum, and these are sacral vertebrae. So this joint is called, the first joint is called this joint, this is called the iliosacral joint, right? Which is the joint between the axial skeleton and the appendicular skeleton, and the function of this is it transfer the weight from the appendicular skeleton to the axial skeleton, right? By this joint, this is the part of, for example, I am shading this in black. This is the part of the axial skeleton, which is the sacrum, the part of the vertebral column, and this iliac bone is the part of the lower limb, the appendicular skeleton. So the joint between these two is called the iliosacral joint, and this is the joint where the axial and appendicular skeleton join to each other. The next joint is here. We have the hip joint. This is called the hip joint. Hip joint is in between the femur plus hip bone, right? This is very important joint. This joint is called, which is synovial joint, which is freely movable joint, and this joint is called the hip joint. The next is, this is called the knee joint, knee joint, right? So this third number joint is knee joint, and knee joint is in between the patella, femur, tibia and fibula, right? The next is the ankle joint. This joint is called ankle joint, and this ankle joint is in between the tarsals plus tibia plus fibula, right? So these are the joints of the lower limbs, right? So these all are the bones of the appendicular skeleton. Just revise, the appendicular skeleton is the second part of the human skeleton, because human skeleton is divided into the two parts, axial skeleton and appendicular skeleton. The axial skeleton, we have discussed this in previous lecture. This composed of skull, ribs cage and vertebral column, and we have 80 bones in axial skeleton. The second part, which is in today's lecture, appendicular skeleton, and appendicular skeleton is composed of 126 bones, right? These 126 bones are further divided into the upper limbs and the lower limbs, right? And if we want to add these all bones, the total bones, we will get 206, and human skeleton have 206 bones. Appendicular skeleton consists of 126 bones. It allows the movements of body, and appendicular skeleton are suspended from the axial parts of the skeleton. This is the skeleton, and this skull, this ribs cage and this vertebral column, it's making the axial skeleton, and these upper limbs and lower limbs, it forms the appendicular skeleton. Right, this is not clear, so we want to write it clearly here. For example, first I am numbering this whole area is, this is upper limbs, right? And this is lower limbs. This upper and lower limbs making appendicular skeleton, right? uh, Here we have discussed the bones of the appendicular skeleton separately. So appendicular skeleton is divided into the upper limbs and the lower limbs. The upper limbs is composed of 64 bones. The 64 bones are divided into right and left parts, right? We have scapula, clavicle, humerus, radius, ulna, carples, metacarples, and pallenges, right? In lower limbs, we have the hip bone, femur, patella, fibula, tibia, tarsals, metatarsals, and pallenges, right? The hip bone is composed of further three bones: the iliac bone, the ischial bone, the pubis bone, right? This pubis bone is this is anterior bone of the pelvic region. This is the posterior bone of the pelvic region, and this is the superior bone, right? So this is all about the appendicular skeleton, the bones of the appendicular skeleton, right? After that we will discuss this all bones in detail one by one, right? We will discuss humerus in one lecture, scapula in second, clavicle in further, and after covering the skeleton we will go for the muscles of which are attached to the human skeleton, right? Thank you.